During the day, we're going to keep the focus on the patient. We're going to keep the focus on the action plan behind the speeches. In the next part of the day, the second part of the day, there are going to be another patient story to deliver. But now, it is very important, of course, that all we are here discussing is delivered to decision makers, and decision makers are under huge pressure in these days, of course, and they have to get the fastest and the best options coordinated from the field either. So it's my pleasure to invite here on the digital stage of ours, State of Play with Digital Health in Latvia, Vision of the Digital Health Strategy and Best Practice Examples of Public and Private Partnerships. Mr. Daniels Pavļuts, Minister of Health of Republic of Latvia. Good morning, the floor is yours.
Good morning. Thank you. Well, dear colleague, Minister Magnus Hoynike from Denmark, Mr. Rees, health professionals from Latvia and abroad, starter person and guests, it's my big pleasure to see such an innovative and enthusiastic crowd online. I have to admit it's been quite a year here for me in this post of the health minister, and I wish I could have been busy with building digital systems. This is something I'd love to have done, but mostly we have managed the pandemic. Now, we've dealt with myriad of problems, and there have been huge projects to implement, not just because of the extremely difficult epidemiological situation and public anxiety and political turmoil, but also many of the things that we've done have been very startup-like. We've had to do innovative things, mending existing systems, doing quick and dirty solutions, culture change, procedures and approaches in no time at all. And it's all been very practical, getting things done and making a difference. So think agile Ministry of Health. Now, but back to the health summit, Data Health Summit here in Riga again. Now this year, we must be practical. Last year, the summit was the first that was oriented largely at policymakers, health managers, and professionals. We looked at the importance of health data, introduced concepts, policies, regulations. So in that sense, it was an introduction. Now this year, we have to talk about real solutions, real opportunities, real benefits for all of us, health professionals, policymakers, doctors, patients, and broader society. As they say, practically no other sector is so ripe for disruption right now as the health sector is. Now, guess what? When I began as a minister, one of my first big projects was related to health data. We had to build a system for managing vaccination rollout because there was none. In 2 to 3 months, everything, registration, appointments, reminders, queue management, vaccination records, logistics. So we took an ecosystem approach, both technically and socially. There was no time for waterfall. Instead of building a new system, we created a backbone connector, an integrator, and joined together existing working software of doctors and clinics and our central e-health system. Now, the best part was the process. It was designed by the whole Latvian IT ecosystem, the best people who volunteered in hackathon style, literally overnight. The best minds of Latvia made requirement analysis, defined technical solutions, and the rest of the people then engaged in actually making it work. I must thank them all again for the generous help and invaluable inputs. Something like that had not really been done in the Latvian public sector before. And actually the system worked in 3 months, as promised. Further, we integrated this year laboratory systems to create European certificates, the digital COVID certificates, with epidemiological monitoring police, border control, also insurance systems, state revenue service, statistics, schools, and so on, connecting systems for the patient's use, for the use of policymakers and solving real problems, like other countries going through this pandemic. We dig for patient data in various public-private sources to understand their demographics, get their contacts, and reach out to them. Never before health-related data has been used so broadly, and never before we used so much data from other sectors for the health needs. Well, the pandemic itself obviously has been a good push for the development and active use of digital services in general. Online visits, online prescriptions, online consultations, referrals, and much more active use of our e-health system by patients and doctors. And it's not just about data and systems. Pandemics also asks for much closer collaboration between organizations in various fields and various levels, primary care doctors, medical institutions, local governments, large and small hospitals, both private and public. So we have already been pushed into working with an ecosystem approach, fostering broad collaborations, coalitions of independent actors, integrating systems and data, developing financing and management systems that facilitate that. Now, and this is exactly how we see the further development of digital health in Latvia. Right now, Ministry of Health is working on development of digital health strategy with the assistance of the WHO. Thank you, World Health Organization, and the local representatives. We're planning our investments for the next 5-6 years to create a new digital health platform. It's going to be a strategic tool for helping to solve a number of challenges in our healthcare. Ensuring access to healthcare, actual access to healthcare, especially in regions. Improving healthcare quality, technologically, methodologically, and with regard to human resources. Improving efficiency, allocation of funds using healthcare resources. Digital health platform is a significant part of our investments for the next years. Moreover, infrastructure and service development projects will have digital health components. It also will be critical for improving our primary care. Telemedicine allows improving patient communication with family doctors and virtual access to secondary and tertiary specialists from anywhere in Latvia. We aim for the development of truly integrated care so that GPs and specialists have all patient data they need. Family doctors are closely connected with tertiary specialists who can provide them with consultations, up-to-date methods and approaches. We call it virtual teams behind the patient's backs, so that they all involve specialists and institutions cooperate seamlessly and paperlessly, leading patients, as Sherpas, helping people move between specialists and treatment phases. We also aim at introducing solutions to improve efficiency of our healthcare, so the doctors have more time for their patients, so that we have better data for treatment, assessing quality and efficiency of services, for research and health policy. And sure, there will be funds for introducing current technologies and methods, broader use of telemedicine, personalized medicine solutions like wearables, assistants and monitors, robotics and AI, remote treatment solutions, new services, and boosting innovation. Now, how are we going to do that? We are not going to build the system. Instead, we, the government, the Ministry of Health, are going to build the core, containing central data repository, EHRs, and allowing different institutions to collaborate. It will be modular, joining patient data from various registries and institutions, allowing to build interconnected health services and letting both private and public providers develop their own products and compete. We see our role as defining standards for the ecosystem, for the digital health ecosystem, for technologies, data formats, data exchange, quality and data security, processes, collaboration, and setting standards for user experience, certifying the systems. Building organizational framework for connecting to the system is also our job, for managing collaboration, management, and payments. We will also incorporate the hospital information systems which are now emerging. We will support digitization of existing data, retroactive patient record digitization, and of course, improving digital skills of healthcare specialists. Further, we want to create a sandbox for all of you, startups and service developers in health. We have a vibrant health tech and medtech community, which I see represented here today among speakers and audience. We see you as main partners and driving force for developing the new health solutions for Latvia and globally. How are we going to do that? It's a question also of our capacity and capabilities. So at the center of digital health organization, we will have to create a digital health competence center, a professional business-oriented unit aimed at helping to develop and integrate the new services, creating the standards and building the core, which I already spoke about. One more thing. Our plan at the moment is that we shall begin creation of this DigiHealth platform with creating a brand new oncology registry, which is long overdue. So thus we would pilot the new approach outlined above. And I hope this might come as good news after the current state of affairs description that Harijs Gals just so poignantly gave us. Dear colleagues, our digital health might sound ambitious to many of you, particularly given our history in this country. But so are goals of the speakers today, and so I believe are the goals that you have. Let us hear from you about exciting opportunities to use digital health data for our patients, for our health professionals and society. We are ripe for disruption. Thank you.